Hello, I am AARP Senior Vice President Bill Walsh, and I'd like to welcome you to this important conversation about simple ways to improve your health this spring and what new dementia breakthroughs could mean for you. Throughout the program, we'll hear from a panel of experts who will share their insights and answer your questions live. AARP is a non-profit, nonpartisan membership organization. We have been working to promote the health and well-being of older Americans for more than 65 years. Through events like this, AARP continues to provide information and resources to help older adults and those caring for them. Spring is here, and if your seasonal allergies seem worse than ever, they are. We'll talk to medical experts about what you can do about allergies and how to improve your overall well-being this spring. We'll also discuss the latest updates on dementia research and new drugs that are offering promising breakthroughs. Our program today is live, and our experts will also answer your questions live. For those of you joining us on the phone, if you'd like to ask a question, press star 3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you're joining on Facebook or YouTube, you can post your question in the comments. Hello, if you're just joining, I'm Bill Walsh with AARP, and I want to welcome you to this important discussion on simple ways to improve your health this spring and what new dementia breakthroughs can mean for you and your loved ones. Throughout the program, our experts will answer your questions live and share strategies for getting healthy and staying healthy. This event is being recorded, and you can access the recording online at aarp.org/conversations, 24 hours after we wrap up. Again, to ask your question, please press star 3 at any time on your telephone keypad to be connected with an AARP staff member, or if you're joining on Facebook or YouTube, you can drop your question into the comments section. Now I'd like to welcome our special guest for today. Dr. Gailen Marshal, MD, is an allergist and chair of allergy and immunology at the University of Mississippi Medical Center and a professor of medicine. He is also immediate past president of the American College of Allergy, Asthma, and Immunology. Welcome to the program, Dr. Marshall.
Thanks, Bill. It's great to be here.
All right, great to have you. And joining us a bit later will be Dr. Kristine Yaffe. Dr. Yaffe is a distinguished professor at the University of California, San Francisco. She serves as vice chair and director of the Center for Population Brain Health. She is also an internationally recognized leader in Alzheimer's research. Welcome to the program, Dr. Yaffe.
I'm delighted to be here.
All right, we're delighted to have you. And just a reminder to our listeners to ask your question, please press star 3 at any time on your telephone keypad or drop it into the comments section on Facebook or YouTube. All right, let's get started. Dr. Marshall, it's a rite of spring to pledge that we'll get outside and we'll get healthier. But of course, that doesn't always happen. What are some simple steps people can take to prioritize their health starting today? And what gradual changes are necessary to avoid the risk of injury?
Well, Bill, I can tell you as a member of the group, I'm in my 70s, and I can tell you this applies to me as much as it does to others that might be listening in. There's several steps that we can do that are really important, but yet there are caveats for each one of us. For example, people talk about us being sedentary as we get older, and in many cases that's true because of health reasons, because of habit, or whatever. But at the same time, it's very important to follow the two most important words of medical advice to anyone over the age of 50, and those two words are don't fall. Because there's so many things that can happen as a result of that. So being mobile is important, but being mobile in a rational way in the context of what you or any of us have in terms of capability. Another is the temperature when you're going to go out. Going outside, I think, is a nice thing, but if it's too cool, if it's too warm, we don't adjust our temperatures intrinsically as well as we might have some years before, so dressing appropriately become very important. The outdoor environment can vary depending on where you are. It can be something as simple as sitting on the front porch. to go out into a park where others are, to actually maybe for some individuals to go out for a walk in the woods, that can be useful, to get in a car and drive around, whether it's on a road trip or whether it's just driving around town. All of those things of getting out and moving around becomes very important because it also relates to good mental activity in individuals who maybe have more physical challenges than others, an active mental state, more than just sitting in front of the television and watching TV. Some talk about playing games, interaction. This is where having friends and loved ones and interacting with them can come in very handy. The advice I always give to folks when they ask about what can I do to be more outside and to do some of these things is that I always advise them to check with their healthcare professional to make sure that there is not a particular problem that would be unique for them that they would want to avoid.
Okay. Well, let's talk about problems to avoid. You are a renowned expert on allergies, and many adults develop allergies later in life, even if they didn't have them as kids. And for some, they may not even be aware of a nagging issue is actually an allergy. What are the symptoms? Are there any serious risks in not knowing?
Well, Bill, one of the interesting things is that when I was in training 30-some-odd years ago, almost 40 years ago, the idea that someone over the age of 50 would have allergies was just not known. The allergies was thought of as a childhood illness that would come into the early years of life, but it sort of waned and went away. And then as we got older, they just didn't have allergies. What's very interesting is that us baby boomers have brought allergy throughout our entire lifespan. And now where we are in our senior years, we still have a significant amount of allergy. And there are a lot of reasons that people have advanced to explain that. One is that we live in a much more complex, stressful world than we have in years gone by, and I've studied how the mind affects the immune system for about 35 years, and we know that there are changes in the immune system that come under times of chronic stress, under anxiety, under depression, things like that, and those changes in the immune system are consistent with the ones that could lead to an increased susceptibility to allergy and asthma and other allergic diseases. The issue about the symptoms of how can I know if I have an allergy versus not, the first thing is that people talk about the word hay fever. Well, it's a misnomer. If you have fever with your nasal symptoms, it's more than just an allergy, and going to your healthcare professional to find out becomes very appropriate. But if you have a combination of sneezing and itching, postnasal drainage, and or maybe runny nose, and then subsequent nasal congestion, that can be an allergic component. But let's layer one more thing on that. And the other thing to layer is that as we get older, we develop a non-allergic rhinitis that is more consistent with the drainage, postnasal drainage, and nasal congestion. And those can be a real problem because they can develop into a chronic cough. They can develop into potential for sinus infections. And while these typically are not things that would shorten your lifespan, there's certainly things that would dramatically compromise your quality of life and oftentimes the resulting function that we talked about at the very beginning of doing healthful behaviors, you just don't feel like it.
Yeah, no, definitely. Seasonal allergies seem to be more severe and last longer than ever before. Is that the case, or does it just feel that way? And how can you lower your exposure to seasonal allergens?
Well, the fact is that seasonal allergens are more common now than they were in years gone by, and this is because of the simple fact of global warming. I recognize, and others do as well, is that there's a lot of controversy about global warming. Does it exist? Does it not exist? What's causing it, and so on. Very few people can argue, again, depending exactly on how you defend it, or define it, rather, but it is warmer for longer periods of time. It gets warmer earlier. It stays warmer later. There's more rain in many of the temperate climates, and that you add heat and you add rain, you're going to get increased foliation. Grasses are going to bloom, trees are going to bloom, weeds are going to bloom, and they're going to bloom longer. And back in the days in the northern parts of our country, and even in the middle parts of our country, they would have 4 seasons: spring, summer, fall, and winter. More and more, the winters are shorter. They may be intense, but they're getting shorter, particularly in the central and southern part of our country. The springs and the falls are getting longer, and the summers are getting much hotter. And the end result of that is that the, quote, growing season, unquote, for these plants that can pollinate to create problems for it gets longer. So the early tree season, the mid grass season and the late weed season are just running together into one long season. And the longer that you're exposed to something that goes on and on, number one, the more likely you are to become sensitized to it. And number two is the more problem you're going to have because you're constantly being exposed to it and your body can never quite catch up.
Got it. Just a reminder to our listeners, if you'd like to get a question in to Dr. Marshall, please just press *3 in your telephone keypad at any time. You'll talk to an AARP staff member and get your question into the queue. Dr. Marshall, the impact of COVID-19 may linger for some older adults for many years, actually. And a study published in Nature Communications last year revealed that allergy issues, including asthma and rhinitis, are notably higher due to past COVID infections. What should we know about this? And are we still seeing an elevated risk 3 to 5 years later?
Well, this is a bad news, good news story. The bad news is that we saw this, and about 3 years ago there was great concern about this while the vaccines were being developed. And the good news is that as time went on, that risk bumped up. It seemed to be related to the severity of the COVID. So people that were really ill, people that were in the hospital and survived and then got well, their risk of developing allergic type symptoms, particularly airway symptoms, nasal allergic rhinitis and asthma, got substantially worse. But the good news is that it's beginning to wane as we get farther away. And people are trying to determine why that is. Is it just the effect of the virus is going away, or is it that by following vaccination schedules that they're actually being better protected? And the data are not clear. People are not absolutely sure, but what does seem to be clear is that people that participate in the vaccine program, not only the initial vaccine during the pandemic, but since then, it does seem to have a protective effect against the development of some of these allergic conditions, such as rhinitis and asthma. Not to mention the fact that as we get older, if we get respiratory viruses, COVID, we get respiratory viruses like influenza, by and large, just because of our age category, our outcomes are not going to be good as our children and grandchildren would be if they got infected. So from a simple public health standpoint, being vaccinated against the COVID, which is SARS-CoV-2 virus, that vaccination is a good thing to have on a regular basis. As best we understand now, the data are clearly there, similar to having your flu vaccine that is protective. And the end result was, will that change over the next several years? Will not be necessary. Nobody knows, but right now it's something that seems to be very helpful.
All right, and right now, what is the latest advice on COVID vaccinations for older adults?
Annual vaccines are still recommended. I got mine. My patients, I'm recommending to them, particularly those that are older or that have underlying immune based illnesses, transplant patients, people with chronic diseases that would modify their immune system. Those individuals we recommend to get the COVID vaccine. And the data that are coming out and tracking them is that it does have a great protection. It's important to say, Bill, that it would be capricious to say, well, there are no side effects, everything's okay, don't worry about it. It's like many other things in life. It's a risk-benefit ratio. And the overall benefit, particularly to people in our age category and in people that have these immune-compromised state, the benefit outweighs the risk that they have, and so that's why we recommend it.
Okay, very good. As a reminder to our listeners, if you'd like to ask a question, please press *3 in your telephone keypad. We're going to ask Dr. Marshall a few more questions on allergies. We are going to get to Dr. Yaffe a bit later to talk about breakthroughs in dementia research. Dr. Marshall, artificial intelligence makes some people nervous as an emerging technology, but maybe you can talk about how AI is being used to diagnose and treat allergies. What new immunotherapies and medications are available thanks to AI?
So, Bill, I have to start this with just a very short anecdote. When AI really started to come out into the literature, both in the lay literature and in the science literature 3 to 5 years ago, but very much in the last 3 years or so, I kept seeing this AI for this, AI for that. Well, remember, our subspecialty is called allergy immunology, and we have forever referred to it as AI. So I wanted to know what in the world allergy and immunology had to do with anything else that was being mentioned, until someone very, very nicely, one of my grandchildren actually, very nicely patted me on the shoulder and said, "Grandpa, AI stands for artificial intelligence, not allergy immunology." So
Okay.
I started mixing it together because in allergy immunology, AI is playing a potentially exciting role. Every patient that's got any kind of an illness, I tell people when they see them, when you were born, you got a owner's manual and a pencil. You never read through the owner's manual completely, and you started marking out things and scribbling in things with the pencil. The owner's manual makes you human. The pencil makes you as an individual. And the trick in medicine is to figure that out. What is the presentation for this patient? Is it part of the owner's manual so it's going to respond like everyone else does, or is it going to be unique for that individual? AI is very useful, and it's helping us collect such massive amounts of data that we can make the pencil, if you will, we can see what the variations are based upon what's in the owner's manual. What is the characteristic? Age, gender, race, comorbidities, other things that would go along with that. This is not a new concept for us, but the ability, the massive amounts of data that AI can handle in such short periods of time have the potential to create great things as to which one of the new therapies should I use for this individual. So there may be 5 therapies for the same condition. Which one is the best for Mrs. Smith compared to Mr. Jones? That is, to me, the most exciting part of AI, not just in allergy immunology, but in medicine together. One of the things is that people take, for example, for us, there are very few of our illnesses that are extremely life-threatening, thankfully. There are a few, but mostly it's quality of life and long-term effects. So the payers get a little bit excited about the idea of paying for some of these medicines, these biologicals that are quite expensive. Why is it worthwhile? Is it worthwhile in this patient and the other? What AI offers is information that's going to say, this is the effect this is going to have in this particular patient to lower their risk to develop this particular complication. I see that as a many different opportunities, but I see that from a provider standpoint. That's one of the most exciting things because I can give the right drug to the right patient at the right time.
Okay. Very good. Just to wrap up this segment, we know that getting health screenings this time of year is particularly important. How often should we get checkups and preventive screenings like cholesterol and blood pressure tests? And are these screenings that Medicare covers?
Well, again, the screening depends on whether the individual have those particular comorbidities. So if they have cardiovascular comorbidities, if they have cancer comorbidities, if they have dementia comorbidities, if they have allergy comorbidities, the screening for those areas should be done more often. But then there are others that affect everyone. For example, everyone should have their blood pressure screened more than once a year. They should have it screened regularly. I'm a firm believer because blood pressure tends to go up as we get older, and it is associated with cardiovascular disease, and it's about the genes, but it's genes that are modified by environmental exposures and choices. So getting your blood pressure checked, same argument can be made of cholesterol. There are not a whole lot of us that have what you would consider to be a really good diet that's low in saturated fats. It's done all the things that we would do. With the increased incidence of things like type 2 diabetes, which is an absolute epidemic in our country, and people that are pre-diabetic, and the number of people, they're now suggesting the most conservative estimate is 2 out of 3 Americans are overweight. And if that's right, those screenings that you just described are much more rational to do. Depending on Medicare, back in the old days, it was a yes-no. Does Medicare cover, does it not? There's so many different Medicare plans out there right now and the coverages are variable. That's where the individual patient takes the time to pick up the phone and call. But these fundamental ones, I don't know of any Medicare plans that specifically exclude them. I suppose they're out there, but I don't know if they do, because they're so fundamentally important to the health of patients in our age category.
Well, and there are a lot of screenings that Medicare does cover across plans. And, for our listeners, if you want to see what they are, you can go to medicare.gov and see that list of screenings. You can also see it at AARP.org. I was looking at it earlier today, and Medicare covers things like cardiovascular disease screenings, colorectal cancer, diabetes, glaucoma, lung cancer, and of course there's a free annual wellness visit. So there's a lot there that Medicare covers. I'll tell you what, Dr. Marshall, we have a line of our listeners who want to ask you some questions, so let's go to the phone lines. I want to bring in my AARP colleague, Kevin Craiglow, to facilitate your calls today. Welcome, Kevin.
Thanks, Bill. Happy to be here for this important conversation.
All right. Who do we have first on the line?
Our first caller is Ruth from Louisiana.
Hey, Ruth. Welcome to our program. Go ahead with your question.
My question has to do with itch, body itch from the scalp to the eyelid, the gums, and all the way down to the middle of the body, and then, of course, all the way down to the ankles and feet. Is there any thing that someone can suggest as to why a constant itch? I mean, it's not seasonal, it's annual.
It's chronic, it sounds like.
Chronic,
yeah.
I guess is the word I'm looking for.
Well, let's ask Dr. Marshall about that. Dr. Marshall, what can you tell Ruth?
We actually see this in not uncommonly. And it could be, the assessment is we want to know, is there a fine rash or is there not? Does the skin peel more regularly? Does it not? And we ask questions that are exposure questions. And for this total body, one of the early things we think of is it possible that they've got some sensitivity to a component of certain soaps. The workup that we can do, it's a fairly straightforward. Most allergists in their office do this with some regularity, and the assessment of that, and it can be categorized. The obvious thing is that if you can remove what the inciting agent is, then the itch gets better on its own. If you can't remove it or can't identify it, then there are medications that are used that are more than just simple antihistamines that very, very often can help control the itch for the individual. The last point of this is important is that itching can be a sign of other underlying diseases, and so screening for those underlying diseases is also important as well. I would simply recommend that you go and see an allergy specialist and have that individual take a look at you and see what she or he could do for you.
Okay, very good. Kevin, let's take another question.
Bill, our next guest is Dawn from Kentucky.
Hey, Dawn, welcome to our program. Go ahead with your question. Hey, Dawn, go ahead with your question. All right, maybe we take somebody else, Kevin.
Absolutely. We've got Rudolph from Maryland.
Hey, Rudolph, welcome to our program. What's your question?
Yes, my question is that I've had the eczema now for months and months, and my criticism is the way it's been treated. Number one, they just you go from here to here, and they send you to one doctor, and they put you on a steroid treatment where you take 7 tablets the first day, and so on. And 6 the next day, and what have you. And they say if this doesn't work, go to the hospital and what have you. And so the thing is, you finally end up going to the hospital, and the hospital looks at it and they say, "Oh, we're going to refer you to someplace else." And so the hospital never did make any attempt at checking my for Lyme disease or my immune system or for thyroid or anything like that. And I think they just run a regular check when you walk in or your blood count and what have you. And so they were non-responsive, and they send me somewhere else.
Well,
and they send me somewhere else, and they give me some salve. And they say it's just it's not necessary. Nobody has ever found out what I'm allergic to.
Well, let's ask Dr. Marshall, Rudolph, and see if he has any insights. Dr. Marshall, any thoughts on what could be Rudolph could be suffering from?
Well, there are a couple points. And Rudolph, from your age, from your voice, I can't tell exactly how old you are. So if you're not, say, above 65, forgive me. But as we get older, our skin tends to get drier. And eczema, what it amounts to eczema too much is a proliferation of the layers of the skin, gets away from the low blood supply that's down in the base of the skin, and then the tissue dies off and it gets flaky. And it's like a total body dandruff if you think about it that way. So the most common reason for it is some kind of inflammation, and it sounds like they've tried to treat that with the creams and the steroid packs and so on and so forth, and haven't really figured it out. The idea of it being a specific etiology or a specific cause that can be found, unfortunately, sometimes we use the word idiopathic, and I tell my patients, think an idiot means I'm not smart enough to tell you. And it should be a working diagnosis, not a final diagnosis, meaning we can't find out yet, but can we do something that would give you relief? The two doctors, if you've not seen, the two types of doctors, if you've not seen them yet, that I would recommend is either a dermatologist or an allergist. And the value of those two individuals is that they can address it. And if they can't help you, they should tell you, I can't help you because it's not this, it's not that, it's not that, but I will try and see if I can send you to the next individuals to do. Eczema is difficult to treat in adults, but it's by no means impossible. And I do know those two specialists, allergists and dermatologists, are the ones that probably treat it the most.
Okay, very good. Kevin, let's take another question.
Yeah, Bill, our next question comes from Lisa, who's listening to the program on Facebook today. And Lisa asks, does it help to wear a mask while outdoors, even if you've never been diagnosed with allergies?
Dr. Marshall, what do you think?
Yeah, it's a great question because I think people wear masks. The pandemic helped us wear masks. But here's the thing. For some people, it might well be useful, but the most important thing is that it's usually at the level of something like an N95 or the Korean version, which is a KN94. It's much less expensive than the N95 mask. The biggest problem we have is that, think about, we put the mask on, it restricts our breathing, so it's not comfortable to run around and walk around with a mask, so we wear it kind of loose. Heaven forbid there are people that let their nose outside of it. That mask is worthless if their nose is out. If they put it over their nose, it's got to be put down for a part that you're actually breathing through the mask and not around the mask. And the way you can tell that is put your sunglasses or your regular glasses on, put your mask on and breathe through it. If you're fogging up the bottom of the glasses, that air is going around that mask, and it's really not a very usefulness. So it's, in order for it to be of any use, it's got to be sealed. It can certainly be of value because it can limit your exposure through your nose or through your mouth. But again, it's difficult to breathe with that. Most people don't like doing it. They wear it loose enough to where it's not restricting their breathing. Well, then it's not really doing its job.
Okay. All right. Thank you, Dr. Marshall. Kevin, let's take another question.
Absolutely. Our next caller, is Donna from Virginia.
Hey, Donna, welcome to our program. Go ahead with your question.
Thank you. Balance is increasingly important as we age to avoid falls and all the problems that can present. And I'm wondering if the doctor had any special recommendations about exercises we might be able to do to strengthen our knees and ankles, which I think are fundamental in this kind of thing. And I wanted to throw a second question in, which I didn't pose before, and that would be, are there any special vitamins that the doctor would recommend we take as we age?
Okay, great questions, Donna. Dr. Marshall?
So the first question was related to
exercise that could strengthen kind of knees and ankles and help with balance.
In talking to my physical therapy colleagues, my internal medicine colleagues, and by the way, I was an internist before I became an allergist, immunologist, so I can at least talk to them about it. The idea, and you'll see this, I don't know about you, but it seems like that I get slammed on this in various and sundry online things, and it's called chair yoga. It's a version of what we did in years gone by, where we would recommend to people to do good exercises sitting down to begin with, till they built up their cardiovascular stamina, till they built up their pulmonary stamina, and built up some of their muscle strength, both upper and lower. That can do that. The balance issue that the caller mentioned is extremely important because we do tend to lose our balance for a variety of different reasons. One of the reasons is that as we stand up, in days gone by when we were young, gravity tries to pull the blood away from our head and our brain, and our cardiovascular system could overcome that. That slows down, or that ability to do that slows down as we get older, so you have to be a little bit more careful about getting up and maybe steady yourself for a little bit beforehand, before you start moving. But the strength and the stamina comes from moving your arms and legs, and in many instances you can do that with a chair, you can do that sitting down, so have to worry about the balance issue. If it's too much for you, you simply stop. And you don't have to find a way to sit down. You don't have to fall down. You don't have to trip. You just stop. Recover that and then increase it. And what I tell my patients to do, and I do it in the context of asthma patients who are having problems with their breathing, is that I get them to do it for a short period of time, a minute, 2 minutes. It shouldn't be too much. And until they get bored with that, and then I get them to add a minute at a time. And they'll work their way up to 10 or 15 minutes of vigorous exercise to the point that they can sweat and they can have problems with, not problems, but characteristics of, gee, I'm tired, I've had a good workout, and they never had to worry about balance. That's one that I recommend, and that one that I think can be done in a very safe fashion.
Okay, very good. Dr. Marshall, thank you so much, and thank you for all those questions. We're going to take more questions soon and hear about breakthroughs in dementia research. But right now, I want to just take a minute and share a quick advocacy update in a segment we call Fighting for You. Joining us from our North Carolina is a retired school administrator and AARP volunteer, Mrs. Lillian S. Lee. Welcome to the program, Lillian.
Thank you. Happy to be here.
All right. We're happy to have you. Now, Lillian, you've volunteered with AARP for many years, sharing your time and talents across a whole range of leadership roles. Why is serving others so important to you?
Yes, I have a passion for volunteering and strongly support the importance of AARP's work in the areas of brain health, caregiving, and advocacy. I'm dedicated to helping connect AARP members and other seniors to AARP's wide array of valuable resources. I believe in a vision where everyone can age with dignity, and I want to contribute to that.
Okay, that's wonderful. Thank you so much, Lillian. And you mentioned advocacy. Now, can you share some of the important issues AARP is fighting for right now?
Sure. Protecting Social Security and Medicare are always top priorities, and right now that fight is critical. Social Security is your money. You worked hard for it, and you deserve to keep every cent. AARP is urging Congress to safeguard Social Security for the future, ensuring every American gets the benefits and the services they've earned. AARP is also fighting to strengthen Medicare and lower prescription drug costs. In fact, AARP recently led the charge for Medicare prescription drug reform, which is saving seniors thousands of dollars.
All right. What are some of the other important issues AARP is advocating for, Lillian?
Sure. Fighting fraud and supporting family caregivers are both essential. Fraud has reached an all-time high. Scammers are everywhere. AARP is urging the government to take stronger actions to crack down on fraud targeting seniors. At the same time, we're calling on Congress and state legislatures to step up and offer support for caregivers. Finally, caregivers are the backbone of care in this country, spending countless hours and money out of their own pockets to care for loved ones. AARP is fighting to ease the physical, emotional, and financial challenges they face.
All right. That's great. Thank you so much, Lillian. Now, if our listeners want to stay on top of AARP's advocacy news, how can they find out the latest?
Well, we encourage everyone to join the fight. Go online to aarp.org/get-involved and sign up for our free advocacy newsletter. And call your members of Congress and tell them to protect Social Security and Medicare. Everyone should make their voices heard.
All right. Thank you so much, Lillian. That's aarp.org/get-involved. Lillian, thanks so much for your service and for being here today.
Thank you.
All right. Let's turn back to our medical experts, and I'd like to welcome into the program the director of the Center for Population Brain Health at the University of California, San Francisco, Dr. Kristine Yaffe. Welcome to the program, Dr. Yaffe.
Thank you. I'm happy to be here.
All right. Well, Dr. Yaffe and Dr. Marshall, the Mayo Clinic has said that exposure to nature can lower anxiety, improve mood, and enhance cognitive function. Can you discuss how spending time outdoors specifically helps to reduce stress and improve physical and mental health? Dr. Yaffe, go ahead.
Sure. So I think Dr. Marshall alluded to this a little bit earlier, but when we're outside in nature, it gives us a chance to be more physically active. It gives us a chance to often be more socially active if you're walking with a friend, say, or playing golf, something like that, taking a bike ride. And we think that by being more active physically, mentally, socially, this really has a great effect on improving brain health. It lowers your stress. It improves mood. We think it actually improves your cognition. And, of course, it's fun. So all in all, it's a great thing to do. It also probably improves your sleep. So I think being outside, being active are really important things to try and do as much as possible.
Okay, Dr. Marshall, did you want to add to that at all?
Well, the only thing, and I agree with everything she said emphatically, both professionally and personally, the only challenge is that if indeed during certain times of the year you do have allergies, so if you've got spring allergies that are significant, there are times in the day where you probably don't want to be outside. The very middle of the day, which is also the hottest part of the day, is when the pollens overall are going to be at their highest level. So in the cool of the day, the pollens tend to be lower. So it's almost a no-brainer again. But there are people that are sun worshipers. They like to go out in the sun when it's warm, when it's hot. And it's just saying during those seasons, those allergy seasons, which in the spring will be going on really till the end of this month, and in some locales even move into May a little bit, you might want to pay attention to the time of day that you're going to go out to protect yourself against allergen exposure.
Okay, very good. Dr. Yaffe, let's transition to dementia. I know our audience is very interested in this topic. Recent breakthroughs in dementia research show promise in slowing its progression. The National Institutes of Health reports that new drugs like lecanemab and donanemab have shown potential by targeting amyloid plaques in the brain. How do the new drugs differ from previous treatments?
Well, thanks, Bill. This is a really, really exciting time in Alzheimer's and other dementia science. After a long time, maybe 20 years without any new drugs, we finally have some new drugs, and it's very exciting. But it's complicated, so I'm going to try and walk you guys through this a little bit. First of all, to remember that one of the issues with Alzheimer's is that there is abnormal proteins that build up in the brain, and we think that these proteins then can lead to neurons dying and sort of a cascade of negative effects. The proteins we're talking about are amyloid and tau. And so for a long time, the science has really tried to focus on how to reduce the amyloid and tau building up. And that's what's so exciting about these new drugs. The new drugs you mentioned, lecanemab and donanemab, actually target the amyloid in the brain and help remove it. So finally, we have a drug that really gets at the heart of the matter. Before we had drugs that were good. They were approved by the FDA and they worked. They just didn't work in a huge amount. And they were safe. They weren't that expensive. But it's like if you have an infection and you take Tylenol or Advil for the fever. It helps. It helps you feel better. But you're not really getting at the infection. So we think with these new drugs, we're actually really getting at the source of the issue.
And now, do these new dementia treatments halt cognitive decline? Can they reverse memory loss?
Yeah, so far we don't see that they can actually reverse memory loss or halt the disease, but they slow it down. So in both cases, both of the drugs, there have been some very well done trials. And so half the people might get the drug and half the people might get a placebo or some other kind of drug. And then you look at the rate of change. And it turns out that these new drugs that bind the amyloid do slow the progression. So you have a different rate of change, but there's no stopping yet. We hope in the future maybe we'll be able to stop. In fact, there are some trials underway where people who don't have symptoms yet are going to be given these drugs. These are people who might be at higher risk for Alzheimer's or for other reasons. And so we'll know, I think, in another maybe 5 years whether these drugs might even prevent. But right now, it looks like they slow the course.
Slow the progression. Okay.
Yep.
What are the costs of these new drugs, and do they tend to be covered by Medicare and private insurance?
So these drugs, let me just say, these drugs aren't for everyone, and that's an important thing to know. The studies were done, by and large, in people who very sort of pure Alzheimer's. They didn't have anything else going on. They didn't have a mini stroke or a lot of diabetes or anything. So it was sort of pure. And in those cases, it looked like it was very helpful. One of the questions now is, well, what does it mean to a lot of other people who might have a combination of different etiologies for their dementia? So that's one question that we now need to find out. The other is that these drugs do have some side effects, and they need to be monitored very closely. So there can be some minor changes that one sees on MRI, with brain swelling or little bleeds, and therefore one has to be monitored very carefully. Thus, these are quite expensive and a little labor-intensive. It's not for everybody. You have to be able to go to the doctor. They're infusions. You get them through IV, and they're expensive. But Medicare does cover them, and you can check with your insurance whether each insurance might be slightly different. But in general, they're being covered as long as your doctor does some monitoring and registering of what's happening.
Okay, very good. As a reminder to our listeners, if you'd like to ask a question, please press *3 on your telephone keypad now, or drop your question to the comments section on YouTube or Facebook. Dr. Yaffe, what are some of the key risk factors for developing dementia, and are there lifestyle changes that can help prevent it?
Yeah, that's a great question, and I do want to give a shout out to something that I'm very involved with AARP, which is the Global Council for Brain Health. The Global Council for Brain Health, it's sort of a mouthful, but it's really an incredible organization within AARP to try and understand what the best evidence is for reducing your risk of Alzheimer's and other dementia, and what can we do about it. So there are a series of reports that we've put together over the last 10 years, and I really recommend your listeners to look at some of these reports because they're really valuable. A lot of information about hearing, about sleep, about what's good for your heart is good for your brain, etc. We think that there's about, maybe 10 to 14 things that really increase your risk of developing dementia and Alzheimer's that you actually can do something about. And in fact, we think probably about maybe 40 to 50% of the risk could be modified or slowed down by paying attention to some of these things. We talked a little bit about physical activity, being active physically, being active mentally, being socially connected, improving your sleep, avoiding a traumatic brain injury, often from a fall, which we heard about. Mm-hmm. So there's lots of things that we can do, and I think it's really it doesn't mean it's going to work 100%, but I think it's really a great way for us to think about, hey, we know we can take care of our heart. How can we take care of our brain?
Yeah, it's a great point. I think people think there's nothing they can do, that it's
Exactly.
destiny, but there is a lot within our own control. A number of our listeners wanted us to repeat the name of the two drugs we talked about earlier. That's lecanemab and donanemab. I'm going to spell those for folks in case my pronunciation is terrible. It's lecanemab is LECANEMAB. And donanemab is DONANEMAB. You can check those out online. Dr. Yaffe, there's always news of various what seem like breakthroughs in dementia research, and earlier this month, the journal Nature reported that there was a connection between the shingles vaccine and a decline in incidence of dementia. I just wonder what your hopes are when you see these sorts of breakthroughs, and do you think we're getting closer to in effective interventions?
Yeah, so that was a really interesting study, and I'll try and explain a little bit why there might be a connection between something like the shingles vaccine and dementia. It doesn't always, it's not always so logical, right? But the idea here is that there are viruses, in particular the herpes family of viruses. So people get chickenpox, or they get cold sores, herpes simplex or herpes zoster, and these, after the actual initial infection, they kind of stick around in the nervous system, in the body, and sometimes they can get reactivated, and they seem to have a preference for the brain. So they get reactivated later in life. That may be when you get shingles. Often as people are older, if they're stressed, if they're sick, they get shingles. And so the idea is by getting the shingles vaccine, you prevent that from happening and you keep the virus at bay. So that's really interesting. And then lo and behold, it turns out that by getting this shingles vaccine, maybe there's a reduction in getting dementia. And why might that be? We think it's because sometimes these viruses may somehow play a role in triggering dementia. I talked about the amyloid and the tau getting deposited in the brain. Maybe it has something to do with the infection or inflammation, something that triggers this. And so the thinking is that if you get the vaccine, the shingles vaccine in this case, that you somehow reduce the chance of getting more of the Alzheimer's or other dementia. And that's what this study found. So actually it's quite interesting. I think we need more research. This was, one study, but it was in a very, very, very reputable journal. So I think it's exciting, and we need to really understand it. The authors actually suggest that maybe there should be a trial, and that is the way we would know for sure.
Okay. Dr. Yaffe, let's go to our listeners. I know they have some questions on dementia research and breakthroughs. Kevin, who is our first caller?
Absolutely, Bill. So Annette had a question about those risk factors, and she's listening in today on Facebook. Her question is, my mom had dementia. Is it hereditary, and what can I do to keep a healthy mind and longevity in life?
Okay, Annette. So a great question. And first, I'll take on the hereditary aspect. This is a little complicated, but in general, if you have a first-degree relative, that's your parents or your siblings that have dementia, such as Alzheimer's, you do have an increased risk of getting Alzheimer's, but it's not a huge increased risk. There are rare families, maybe 1% of Alzheimer's, very, very rare, where it really runs in the family. And that's a kind of different genetics where it's autosomal dominant, inherited. So that's pretty unusual. And those families are very well studied, and chances are people would know if they're part of one of those families. But in general, having a relative, like I said, a first-degree relative, does increase your risk somewhat, but not really that much. In terms of the second part, what you can do, I do recommend you look at the Global Council of Brain Health reports, because it really breaks down some of these recommendations, I think, in a very thoughtful and good communication way. But like we talked about, taking care of your heart health is very important for brain health. Being active, physically, mentally, socially, making sure your sleep is in good shape, making sure your sensory functions, hearing, vision, are as good as they could be. These are some of the fundamental guidelines we offer. Avoiding a traumatic brain injury, improving your diet. That's a little less studied, but we think that something like the Mediterranean diet might be helpful.
What about detection, Dr. Yaffe? I mean, could people take blood tests or PET scans and find out anything about dementia before any symptoms show up?
Bill, you're hitting all the key issues these days. This is another really, really interesting subject that the science has just expanded by gangbusters. And so we're really excited, but we may be a little bit over our skis. We're not quite sure how we're going to take some of the science and make it so it's better for people. Let me explain a little bit. So I mentioned the amyloid and the tau, right? Those are the proteins that are in the brain. And there are ways to know if it's in the brain, but they turned out to be a little bit costly and time-sensitive. You could get a lumbar puncture, a spinal tap, and you could see whether there were proteins in the brain. Or you could get a pretty advanced kind of X-ray, a PET scan, which not every place has, and they would tell you whether your brain had amyloid or tau. And that's where we were really up until about 5 years ago. And it was very exciting because we could actually see whether those proteins were there. And we could see whether they were there even if people didn't have symptoms. So it's complicated. Is having a disease, does it depend on if you have a disease? Is it just having those markers? Or does a disease mean having memory problems and other kind of cognitive problems? So it's complicated.
Interesting.
And then in the last few years, we now think we can measure these by blood. So it's still in the research phase. We're still trying to work some of the kinks out, but it's really exciting. It may be one day you could go to the doctor and ask to have a blood test to see whether you have these Alzheimer's proteins.
Okay, hopefully one day very soon. Kevin, let's go back to our lines. Who do we have?
Absolutely. The next caller is Thomas from Michigan.
Hey, Thomas, welcome to our program. Go ahead with your question.
Okay, thank you. And thank you, Dr. Yaffe. I am 82 years old, and I'm a participant in an Alzheimer's study nationwide that's been going on for some time, and I have annual MRIs and PET scans. But I'm really concerned about the sweeping cuts to the Department of Health and Human Services that seems to be targeting Alzheimer's research to be cut. I would like to continue with the study that I'm in through the local university, but I'm worried about that.
Yeah. Dr. Yaffe, what can you tell us about that?
Well, I thank Thomas for bringing this up because I do think that all of us as citizens and as patients and people, need to decide what we want to advocate for. And I personally think it's very important to advocate for science and medical research. So the things we've been talking about today, both Dr. Marshall and myself, are all due to the fact that the United States is really a leader in biomedical research, the leader in biomedical research. And a lot of that is because of the important work that the NIH and other grant agencies give, to researchers. And so I couldn't agree with you more, Thomas, that it's really, really important that we maintain this critical investment in science and medicine.
Okay. Thank you very much. Kevin, who do we have next on the line?
Yeah, our next caller is Maurice from New Jersey.
Hey, Maurice, welcome to our program. Go ahead with your question.
Hello, I'm 85 years old, and I've noticed I had allergies as a young person, but I've noticed that the older I get, it seems as though I'm having more allergies, and I was wondering if that is typical or is that my physical makeup.
Dr. Marshall, can you talk about that issue?
Could you repeat the question, please?
Yeah, Maurice from New Jersey. She's 85. She was saying she had allergies in her youth, but it also seems that they're getting worse now as she's getting older. Is that common?
Yeah, the interesting thing is that there's two categories like that. There are those that have them in their youth, and they more or less stay throughout their lives, and then they tend to get worse. That's probably that non-allergic component that I talked about earlier that starts to layer over that. And the term that's used is vasomotor. And it's because of things that change inside of our nose and inside of our lungs to a degree with the autonomic nervous system changing how it stimulates the production of mucus, how it causes the membranes inside of our nose to swell, and so on. it's thought to be a protective mechanism sort of gone awry. And there are specific specific therapies that can be offered for that. And most allergists and many healthcare providers would know how to do that. And I would recommend having that conversation with your healthcare provider to see if they are comfortable prescribing the things. The other possibility is that you had it as a child, it went away, and it came back later on in life. We call that reactivation or relapse. That mechanism seems to be a little bit different. It seems to be more related to an allergic component that really is still there. Again, we talked about this earlier as some of the reasons that changes in our environment and so on that might be there. But that's also amenable to medical therapy, but it should be done by someone who is an expert in this area, and I would commend to her to go and see if she can be referred to an allergist for a good opinion.
Okay, very good. Kevin, let's take another caller.
Absolutely. Our next caller is Janice from Massachusetts.
Hey, Janice, welcome to our program. Go ahead with your question.
Sure. 10 years ago, I was in a drug study for Alzheimer's because I have my father and his sister and brother who had some form of Alzheimer's. My dad had a lot. And I was in a drug study 10 years ago, and I didn't have enough amyloid in my brain to become a member of the drug study. And I was just wondering, how can I get involved? Should I ask my primary care? Because I'd love to. Because when I forget where my keys are and everything, I kind of start worrying about it. I'm 76 years old.
Okay. Dr. Yaffe, maybe you can address this. I mean, I think that's a common concern people have, right? Maybe they've had dementia in their family, but then suddenly they're forgetting where they parked their car, where their keys are, and they're worried, am I developing dementia? What can someone like Janice do?
Yeah, well, first of all, I want to thank Janice for her willingness to be part of these studies. It's because of people like her that, we can get some of these exciting results. And Janice, you might, in terms of, I'll talk about the clinical aspects in a minute, but in terms of volunteering for another study, you might look at the Alzheimer's Association. They have a very good website, and there's opportunities to join clinical trials. So that might be a good reference to look to see whether there's another trial happening. You're in Massachusetts, where there's a lot of really exciting work. So that would be one thing. In terms of your symptoms about, the keys and possible memory concerns, I do think it'd be very important. You probably want to start with your primary care clinician, and see about what they think, maybe get a screen, a cognitive screening, and then if there's some concern, you could be referred to a specialist who focuses on memory and dementia. So that would be what I would recommend.
Yeah, sounds great. Kevin, let's take another call.
Yes, our next call comes from Gloria in Virginia.
Hey, Gloria, welcome to our program. Go ahead with your question.
Thank you. I've enjoyed your program today.
Oh, great.
My question is about, in regard to the eczema the gentleman previously was talking about. I had swimmer's ear at least 40 years ago, and I got an eczema in my ears, but they have gotten worse now. I'm 86 years old, and it prevents me from wearing a hearing aid, which I really need. And I have been treated with the Perrigo, TRIAMICINOLNE acetonide cream, which is 0.025 Perrigo, but it's not doing any good at all. It just heals up overnight, and then it starts oozing and starts itching and hurting again the next day.
Okay. Well, why don't we ask Dr. Marshall what his thoughts are. Dr. Marshall, you heard Gloria's question.
I did. And interestingly, this is more of a common problem than you might realize. Gloria, there are a couple things. It turns out that eczema inside the outer ear, which is what you're describing, that is outside of the eardrum, but that area is a much more common phenomenon as we get older than people realize. In many instances, what it can be is contact dermatitis. It can be something maybe related to shampoo that gets in the ear or soap that gets in the ear. It can be related indeed to the fact that you were wearing hearing aids and there was a sensitivity there. What you described as triamcinolone, which is a common mid-level steroid cream that's used to try to stop the inflammation that's there. The fact that it's not getting any better suggests it might even have an infectious component, such as a fungus. There are fungus that can get in there. What I would recommend you do is to get your primary care, depending on your insurance situation. Either you could directly get a referral or get your primary care to give you a referral to an ENT specialist that is a specialist with the ears. They are there, not just the nose and throat, but the ear part. And have them take a careful look at that and see if indeed that they see that there might be the possibility that what you need instead of a steroid is an antifungal cream to go in there. I think they could do you some good.
Very interesting. Gloria, I hope things improve. My friends, this has been a really informative discussion. I want to thank you, Dr. Marshall and Dr. Yaffe, for sharing your valuable insights and answering our questions. We appreciate each of you contributing to this important conversation and answering questions from our listeners. I also wanted to thank you, our AARP members, volunteers, and listeners for participating in the discussion today. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 65 years. All of the resources referenced today, including a recording of the Q&A event, can be found at aarp.org/conversations starting tomorrow, April 11th. Thank you all and have a good day. This concludes our call.